the first wealth, as Ralph Waldo Emerson said, then these are our best investors, making sure that we are healthy today in the Commonwealth and that our communities are healthy tomorrow. These dedicated professionals are at the front lines in Massachusetts of protecting our families, our neighborhoods, and our entire nation. Dr. Rochelle Walensky, the former director of the Centers for Disease Control and Prevention. We thank her for her leadership, the countless lives that were saved during the pandemic because of her leadership. This week she joined with 8 of her former colleagues and heads of the CDC to call out the danger of Robert Kennedy Jr. that he poses as the Secretary of Health and Human Services. By raising the alarm, she is doing what we all must do right now, to stand up and to be brave, to speak the truth and to defend the health of our people and of our democracy. We are also joined by fellow frontline defenders, Dave Foley, the president of SEIU 509, Dr. Mary Beth Mioto, pediatrician at the Mattapan Community Health Center, Dr. Eli Fryman, pediatric emergency medicine physician at Newton Wellesley Hospital, Sarah Beswell, a registered nurse and member of the Massachusetts Nurse Association's Board of Directors, Dr. Christopher Locher, CEO and co-founder of Versatope Therapeutics, and Dr. Hannah Grunwald, postdoctoral fellow at Harvard Medical School. Our nation's public health is at risk because of the reckless and dangerous actions of President Trump and Secretary Robert Kennedy Jr. This has never been clearer amid the chaos at the Centers for Disease Control and Prevention than when Secretary Kennedy forced out CDC Director Susan Monarez and other top CDC officials because they would not rubber stamp his anti-vaccine, anti-science recommendation. So he fired Dr. Monarez. During his Senate confirmation hearings last January, I called Secretary Kennedy unqualified, dangerous, and unfit. And I told him he was disqualified from holding any position in healthcare in our country. I said that as the ranking Democrat, the top Democrat on the Health Subcommittee of the United States Senate. That was in January. Unfortunately, Republicans ignored his obvious anti-science, anti-health beliefs, and in fealty to Donald Trump, they confirmed him anyway. Our worst fears were exemplified yesterday as Secretary Kennedy testified in front of the Senate Finance Committee. Kennedy did not know how many Americans died from COVID-19. The answer is 1.2 million Americans died. Kennedy said he didn't trust the data that showed vaccines were safe and saved lives. He lied to Senator Warren when he said, quote, anybody can get the new COVID booster, even though his FDA just restricted who is able to get the new vaccines. He lied and said there were no cuts to Medicaid in Trump's big, ugly bill, which the Republicans supported and passed. So it's lie after lie after lie from Robert F. Kennedy Jr. The only truth we came away with is how dangerous Robert F. Kennedy Jr. is to the health of our nation and our communities. This isn't a man who is guided by the Hippocratic Oath. He is guided by hypocrisy. And he always has been when it comes to vaccines. He made money off of vaccine denial. He made money off of spreading disinformation. And now he is appointing his own former cronies to positions at the CDC that will only further spread that misinformation about vaccines. Vaccines are not debatable. They are dependable. In 1900, in the United States, 18% of all children died before the age of 5. Life expectancy in the United States in 1900 was 48 years of age. What changed? Vaccines changed. All the other public health interventions that we built into our system changed. We've added 30 bonus years of life to Americans. That's what's changed. Robert F. Kennedy Jr. isn't selling a Make America Healthy Again agenda. It's a Make America Sick Again agenda that Robert F. Kennedy is selling to the American people, and we have to stop it. Ever since he was confirmed, Kennedy has been recklessly gutting life-saving research, slashing community health center funding, spreading misinformation and outright lies about vaccines and science. Sadly, misinformation spreads as fast as COVID, as fast as measles and other diseases. And these diseases know no state boundaries. People in Massachusetts are endangered if people in other states aren't getting their vaccinations. We have a highly mobile nation. And right now, after the largest measles outbreak in 33 years that affected 1,300 Americans, Florida has announced its plan to scrap all vaccination requirements for children. That will be a public health calamity. The price of admission to Disney World shouldn't be a case of measles or COVID for a child from Massachusetts being taken by their parents down to Disney World this winter. We need every community to know that Robert Kennedy Jr. is doing what is endangering our public health, and so we must now defend ourselves. And that's why today I am releasing a tracker that will update regularly all of the dangerous actions Robert F. Kennedy Jr. has taken since he was confirmed as Secretary of Health and Human Services. I am releasing it and putting it up so it will be there for everyone to see where the dangers are that Robert F. Kennedy has created. The RFK Jr. attacks tracker includes firing more than 10,000 employees, including 2,400 staff at the CDC, firing all 17 experts on the CDC's Vaccine Advisory Committee, and replacing them with vaccine skeptics, including some with whom he worked in order to spread for pay that disinformation about vaccines. Updating the FDA authorizations for COVID vaccines in August so children and those under the age of 65 can no longer access COVID vaccines. These recent changes to COVID vaccine authorizations are already causing confusion and uncertainty for patients, providers, and pharmacies alike. We know that pharmacies such as CVS and Walgreens are introducing prescription requirements, if not outright suspending access to new COVID boosters in some states as they navigate a patchwork of conflicting federal, state, and local rules. And that is why today I am also sending a letter to CVS and Walgreens to ask them about their recent policy changes to vaccine access at their pharmacies across our country. We are grateful that Governor Healy has taken the important step to protect us here in Massachusetts by requiring health insurers to cover vaccines recommended by state health officials, regardless of what the CDC recommends. But the American people deserve clarity, accountability, and rapid corrective action to restore vaccine access. They deserve a top health official who believes in science, who can be certain to make decisions to protect the health of every family in our state and across our nation. So none of this is a surprise. At every hearing And in every decision, RFK Jr. has consistently peddled lies at the expense of public health. And Republicans continue to refuse to hold RFK Jr. accountable in any meaningful way. The Republicans knew he was lying when he told senators during the confirmation hearing in January that he was not anti-vaccine, despite evidence that RFK Jr. for years regularly ignored scientific evidence and spread vaccine misinformation. Yet they voted yes to confirm him. The Republicans knew he lied when RFK Jr. claimed no responsibility for perpetuating anti-vaccine sentiments in Samoa that led to a measles outbreak that killed 83 people. Yet the Republicans voted yes to confirm him. The Republicans knew he lied when RFK Jr. promised that he would do nothing that would make it difficult or discourage people from taking vaccines, despite his efforts in 2021 to petition the FDA to reverse its emergency authorization for COVID vaccines. Yet the Republicans voted to confirm him as the Secretary of Health and Human Services. Republicans would rather protect Trump than the American people. And we are now seeing the all too real consequences of their actions. We know our healthcare system is broken. It's a sick care system controlled by insurance companies and pharmaceutical companies just trying to make a buck at the expense of Americans' health. We need families to have faith that its leaders support a health system that puts patients, not profits, at the center of accessing of care. That's the system we need to have built in our country, not dismantled, but made even stronger to protect the health of the American people. So I call on every one of my Republican colleagues, join me, join my Democratic colleagues, the multitude of medical associations, healthcare providers, 9 former CDC directors, over 1,000 current and former HHS employees, and demand the resignation of Robert F. Kennedy Jr. I demand that Robert F. Kennedy Jr. resign as Secretary of Health and Human Service. He is endangering the lives of every American family with his policies. So let me now stop and introduce a great leader for the public health of our nation, Dr. Rochelle Walensky, the former director of the Centers for Disease Control. Doctor.
During a press briefing on Friday, Senator Ed Markey, Democrat, Massachusetts, called for Health and Human Services Secretary Robert F. Kennedy Jr. to resign, citing his dangerous actions and disregard for public health. Markey condemned Kennedy's behavior, particularly his attempts to undermine the Centers for Disease Control and Prevention, CDC, and his anti-science, anti-vaccine stance. Markey was joined by several health professionals who shared concerns about Kennedy's leadership and its impact on the nation's well-being. Dr. Rel Winsky, former CDC director, and other prominent figures in the health community voiced their support for Markey's call, accusing Kennedy of spreading misinformation about vaccines and COVID-19, which they claimed directly jeopardizes the health of Americans. They highlighted Kennedy's history of making profit from anti-vaccine movements and argued that he was unfit for a position overseeing public health. Markey pointed to Kennedy's failure to accurately address the number of COVID-19 deaths, his lies about vaccine safety, and his dismissal of key officials at the CDC who disagreed with his stance. Markey expressed frustration over the fact that Kennedy was confirmed despite his history of anti-science rhetoric, which, according to Markey and other health experts, has now led to harmful changes in public health policies, including restrictions on COVID vaccine access and cuts to vital health services. In response, Markey stressed the need for a public health system that prioritizes science and the well-being of Americans. He called on Republican lawmakers and health professionals to join him in demanding Kennedy's resignation, warning that Kennedy's policies were endangering not just public health, but the very fabric of democracy itself. Markey's comments were part of a broader effort to ensure that those in positions of power are held accountable for their actions, particularly when those actions threaten the safety and health of the public. As the situation continues to unfold, the demand for transparency and accountability grows, with many calling for a change in leadership to protect public health across the nation.